Dr. Aaron Adams. I'm a family practitioner. I'm from the community and been in practice for over 40 years at this point. And still do enjoy doing the acute care and seeing a lot of patients and their families that I provide those services for a long time. Well, they're useful because a lot of our patients cannot afford to pay the regular fees, and the low-cost profiles are excellent because that information can be handed over to the provider and decision-making can be done. Maybe they're not on medications, maybe they are on medications, and you can compare that information and decide how to proceed with their care plan. Affordability of medical care is a real problem, and these are good ways, and it encourages people to get out into the community and take advantage of low-cost screening testing, whether you're doing ultrasounds for carotids, aortic aneurysms, or doing screening for diabetes, lipids, or whatever you're looking for. It's certainly valued to the provider and the patient care. As you look at these low-cost testing panels, starting with a comprehensive metabolic panel, you can look at somebody's blood sugar, you can check their kidney function, their liver function, their calcium levels, and so forth to determine a lot of different things going on with their health care. A complete blood count determines whether they have a low white count, which is a complication of maybe their of infection, or they have a high white count, which could mean infection. You can screen for anemia with the hemoglobin, and your platelet count determines how your blood will clot. And you look at thyroid stimulating hormone, the TSH, that determines your metabolism. Actually works on your activity level from your thyroid gland, and basically what that can affect is your ability to remember, particularly in older folks, because older folks, that's part of the screening process, is do a TSH, because if they're underactive, then that can also affect their ability to affect their cognitive function. Lipid panel is obviously a good screening evaluation for cardiovascular disease. It gives you an idea if you're on medication and you take advantage of that $25 charge, whether your medication's got you at your goal. So these are important things, and for an additional $5, you can do the hemoglobin A1C, which is the gold standard. It's an outcome measure of what your blood sugar average is for the last 90 days. And most physicians determine that is whether your patient's controlled or not controlled and how they're doing. And it's a teaching tool to talk about complications of diabetes. Our goal is to keep that number under 7, because if it's under 7, your cardiovascular risk and complications of diabetes are much less than they are if they're over 7.